Good afternoon. My name is Larry Giantonio, and I work for the Manhattan Star Academy, and welcome to StarLight Sessions. Today I'm here with Megan Fuji, who is one of our speech pathologists here at MSA. Megan, hi, how are you?
Hi, Larry. Thank you for having me at a StarLight session. I'm really excited to be here.
Great, glad to have you. Tell us a little bit about yourself and what you do.
Okay. So I'm a speech pathologist here at Manhattan Star, and I have been practicing for 15 years in the field of speech and language pathology in numerous capacities. And during that time, I have always worked with children with complex communication issues, and really my specialties have evolved into working with kids that are nonverbal or verbal or having difficulties expressing themselves, may have speech apraxia, and finding ways for them to communicate using a total communication approach. And what I wanted to talk about today was one of those avenues of assistive technology and how we can use assistive technology to give a child with complex communication needs a voice.
So AAC.
Yes.
What does that stand for?
AAC. AAC stands for Augmentative Assistive Communication. So a lot of people have the misconception that using AAC or alternate means of communication, such as technologies such as picture communication systems or iPads or dedicated devices, will actually not encourage a child to use their actual verbal skills. However, AAC is giving a child the alternative of communication so they can have a voice. And here at Manhattan Star, we really feel that every child has a voice, and we really want to find their voice so they can tell us what they want, what they need, and can learn.
Wow, that's fantastic. Are there different levels of how the kids use this technology?
Sure. So AAC is really just thinking of AAC as any alternate means of communication.
Okay.
We use alternate means of communication every day. I could wave and say hi to you, and that's an alternate. You know that when I wave to you, I mean to say hi.
Right.
That's a very simple gesture. We use gestures, we use facial expressions, but then we can take it a little step further. We often all use visual cues throughout the days when we're doing recipes and we see recipes in a magazine. That's an alternative way to communicate. Oh, that's the idea that I want to come up with. And the same things with kids. We can use pictures to help them understand language and express language. As language develops, you first have to understand it and then express it. And if you can't do it verbally, then maybe you can do it through showing a picture, pointing to an object. But then with the technological advances that are going on today, we have the availabilities of iPads and higher technology and at our fingertips, and to access that so much quicker than we were able to do even 3 years ago.
That's amazing. It kind of sits in with what I've come to learn as like a coined phrase, blended learning in the classroom. And this actually fits into that quite nicely.
Absolutely. All AAC is looking for alternate ways to really hear a child's voice. So here at Manhattan Star, we do that through the smart boards and giving them visual cues through the day. We do that through picture schedules to help them know and anticipate. And now we're really implementing some iPad apps and some dedicated devices into the natural day, embedding it into their day and using it so that the child has a voice and has a way to communicate. They might not be so efficient at it, and that's okay. We're all learning and we're all,
right,
growing with it. But if we model using the device and if we have it accessible for them and have their talkers with them at all times, we're starting to hear a lot of voices. So it's great. It's really exciting.
That sounds amazing, and I look forward to seeing it in action down the road.
Absolutely.
And we'll have to follow up down at some point, have another session with you
I'd love
here
it.
at StarLight.
Great.
Great. Thanks, Megan, for your time.
Thank you.